Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and I am here once again to discuss a topic near and dear to my heart with my most excellent colleague and tremendous wound healing guru, Dr. Millicent Ravello. How are you doing, Dr. Ravello?
I'm doing okay. Thank you. Thank you for asking. I am a wound healing expert. I've gotten lots of wounds to deal with recently. Thank you for reminding me. None of my own.
I understand.
Not from my patients, but as plastic surgeons, we are wound care experts.
Yes.
We actually are, not being facetious there. So we do get a lot of questions from our colleagues on how to treat wounds.
Yes, we do. But we will leave that out of the discussion today.
That is not the topic of this podcast.
No, because I don't want to have a disturbed and deranged Dr. Ravello here after a discussion about wound healing. So we will skip right to blepharoplasty.
Much better. That is such a nicer, cleaner topic. I can get on board with that.
So blepharoplasty comes up a lot where it's interesting. We are plastic surgeons, but the ophthalmologists do blepharoplasty also.
What is blepharoplasty? We have not defined that term.
So blepharoplasty is eyelid surgery. It's the changing of eyelids, typically taking skin out of the upper eyelids and some fat, either repositioning fat in the lower lids, taking some out, tightening the lower lids. There's a lot that goes into blepharoplasty. It's not a brief topic.
No.
But it's interesting because I always have patients ask me, like, do you do that? I'm like, yeah, of course I do. I'm a plastic surgeon.
Yeah, that's sort of part of our gig.
Kind of a lot of our gig.
Yeah.
There are ophthalmologists who go on to become oculoplastic surgeons who do a lot of it, who are very, some are more talented than others, obviously, same in plastic surgery.
Yes.
But eyelid surgery has to be something that you're comfortable with because it's tricky.
It's tricky. It is not so simple. It's not just cutting out a little bit of skin here and there. Sometimes it can be that simple, but there's as you would expect, the eyelid anatomy is quite complex. So there is definitely an art and a precision to it. I think the oculoplastic surgeons, I think that's like a 2-year fellowship for them. I mean, obviously they do their whole ophthalmology residency, which I believe is 4 years. And then if they want to go on to do oculoplastics, which is surgery of the eyelid, they do 2 whole years of it on just the eyes.
Yeah.
So yeah, it's complex and it's definitely a very unique part of the face.
And the reason that it's tricky, and I use that term because you have to understand how to make a diagnosis when it comes to lower lids. And when people say, I want to get my eyes done, I think we've talked about my friend who came in like pushing on his neck saying, I just need to get my eyes done.
Those aren't your eyes.
Yeah, that's called for a man, it's a neck lift with upper facial extension. But getting your lids done means typically we're talking about taking some skin out of the upper eyelids and also taking some fat out, possibly. We take less and less fat out lately because people want the fullness. You don't want to have that, skeletonized kind of...
Very 80s look. Back in the 80s, they would hollow out the upper eyelids. And so you know the look. It's like that soap opera star look in her 50s who's just got those really hollowed out eyes. It's usually because someone did upper eyelid surgery on her and took out a lot of the fat that was in it, because the thought was that fat would bulge forward and kind of create this bulging effect around the eye. But in reality, that bulging effect around the eye is actually a sign of youth, and when you take it out, then you start getting more of an aged look. So when you're talking about blepharoplasty or eyelid surgery, it's usually divided into upper and lower. And they are 2 totally different surgeries. They can be done together, but again, anatomy is totally different, and the goals are usually quite different between the 2.
Yeah, and the way you approach it is totally different
also.
It's
totally
different. The first thing, though, is you have to make a proper diagnosis as to why that person is standing in front of you saying, I kind of want to get my lids done. Because a lot of times it's not just the lids, it's the cheek, it's the the fact that they're like polar bear syndrome where their cheekbones are behind